First, let's learn about the remote. The remote attaches to the frame. The opaque triangle on the motor matches the one on the remote to guide your direction. Press each arrow to familiarize yourself with up, down, forward, and back. Lay out the harness yellow side up. Use the gray, not the green straps, and the seat belt. Position the patient with their rear at the base. Then reach for the seatbelt straps before doing anything else, reaching across the waist and securing. Then reach along the sides of the patient's legs, taking the hip straps, wrapping them underneath each thigh, and then crisscrossing them for future security once the patient is lifted. Once doing that, make sure that the patient's arms are not flailing and that they are within the insides of the harness if possible. Making sure your patient is secure, bring the motor along the track and then lower the frame right above your patient. It's now time to attach the harness to the frame. The frame has two hooks on either side, one for the gray shoulder strap, the other for the gray thigh strap. Attach each shoulder strap and each thigh strap to the hooks. With each strap securely in place, remove the remote from the frame. Press the upward arrow and hold. Anytime you remove your finger from the arrow, the lift stops. You can move the lift with the remote, or you can push it manually. Give a firm pull to get the lift off the stationary track and onto the boom. The boom is a track that slides across the room, allowing you to lower the patient anywhere. Press the downward arrow on the remote to lower the harness into the chair. Make sure you press the patient back into the chair for proper alignment. Now you can remove the straps. Be sure to pull the leg straps to the sides in the case of a future accident. Then lift the frame away from the patient and they're all set with the harness in place for the next transfer.